Hello and welcome to the Primetimers. I'm your host, Marty Moore, and today we're going to make you aware of things you should be careful about for your own safety and for the safety of others around you. You know, it's fun to take a trip, but it's not fun to take a trip to the emergency room because you fell here or you fell there. And did you know 1 out of 3 people 65 years and older are going to fall? We're going to talk about awareness because I don't want you to be one of those people. Joining us today from the Mendelssohn Kornblum Orthopedics is J.B. Jansen. He's a physical therapist, and we're going to talk about awareness, safety, and keeping your balance. Hi.
Hi.
Welcome to the program. I'm glad you could be with us. J.B., I don't know really where to start other than why are so many people falling?
Well, we could talk a little bit about the statistics first. Like you said, 1 in 3 people fall, and as a result of that, about 2.2 million people end up in the emergency room every year to be treated for an injury related to their falls. And as a nation, we spend $30 billion to treat those people. That treatment is important. Physical therapy, we're an important part of that. It's part
I don't think people think about the physical therapy part of it when they're coming into the emergency room. So you probably are a surprise to them as far as I'm going to have physical therapy. I bet you bump into that all the time too.
Yes, yes.
You know, like they don't realize that it's a must. It's not should ya, it's do it.
Right. And the unfortunate thing is that a lot of people, if they experience their first fall or a near fall, is they become afraid to move around. And as a result of moving around less, they now become deconditioned and they're even more likely to fall.
It makes it even worse.
Right. So in physical therapy, we try to encourage activity, we work on their balance, we work on their strength, and we assess their condition to try to get them to a safer level of ambulation and functional mobility.
Well, I can see why if you know, you stick your hand on an oven, you burn your fingers, you're gonna pull away from that. But without their strength, they're doing themselves a great disservice. Like, you know, like what are some of the key risk factors to be aware of? And maybe if we think about it ahead of time, we can avoid some of those things.
Well, there are basically two categories. First is the home environment, and the other is the medical condition of the patient or their physical health. And so let's talk a little bit about the physical environment. There are a lot of things in our home that can cause a fall. Things like slippery floors, extension cords, it could be unsafe stairways, it could be lack of lighting, a myriad of things that can result in a fall. And by themselves, these things are not that dangerous. When you're young, you could trip and you recover.
Exactly.
But as you get a little bit older, as your reaction time slows and you're a little bit weaker, sometimes those little trips can result in a fall, and that fall can injure a patient. About annually, like I said, about 2.2 million people end up in the emergency room to be treated.
That's a lot of people. So obviously, people need to be a little more aware of their surroundings. So we say, "Oh, it's my house. It's my home." Put one footstool out of order for somebody that's 65 or older, I can almost guarantee the results. It's going to be a trip to the emergency room.
Exactly.
Because you forget it's there, or you're in a hurry. Talk more a little bit about that.
Well, I think it's important that you know your environment and that you know your condition. if you're a senior and you're on more than 4 medications at the same time, you have to understand that you are at increased risk for falling. There are certain medications that can also increase your risk, such as blood pressure medication, corticosteroids, some of the non-steroidal anti-inflammatory drugs, the depressive medication, anti-anxiety medication can increase your risk for falling. Also, when you change your medication from one kind to another, there is a period of time that you're at increased risk for falling. Then your medical condition itself can lead to a fall. Maybe you have a lack of sensation in the feet to where you not feel everything that's going on below you. Your balance can be impaired. You can have weakness.
Balance is a key right there.
Balance is a key. It's very important, and reaction time is also important.
As
we get a little bit older, we don't respond so well to the changes in our environment. So I would say assess your home environment first, make sure that it's safe, and then get an assessment of your physical health, and maybe a referral to a balance specialist or a physical therapist that can help you with that would be a good idea.
Well, I mean, also you have to come to recognize that if you are a person with osteoporosis, that fall is going to be oh so bad.
Definitely.
With the brittle bones. I think, too, by some of the things that you had mentioned, if we could just put them upstairs in our little computer and be aware of these things. It doesn't mean it's going to guarantee that you're not going to fall, but maybe panic won't set in as easily, or it might remind us, as you mentioned, take a little more time. Look around and see what you have to work with. I know it's your home, but you know, maybe when you left, the stairs are all nice and clear. You come back, the stairs are not all nice and clear. Look.
You couldn't be more right. And another thing that's really important is for people who have experienced the fall to talk to the medical professionals about it. I mean,
you think they don't?
They don't. Only half of the people who experience a fall actually talk to the doctor about it.
Oh my.
And what I find in physical therapy when I treat some of these folks is that it's actually the caregiver or the family member that has indicated to a physician and is now talking to me about it. And that's why we treat them. A lot of times the patients themselves tend to tuck that away and don't want to talk about it.
They don't want to talk about it. They're probably afraid, you know, people think less of them, or maybe they're getting too decrepit, or maybe they just need a medicine change. But how's the doctor going to know?
Right, if you don't talk about your falls, especially near falls, are important to mention. Say, doctor, a couple of times I almost fell when I was trying to get into the home, or I almost fell when I got out of bed. Those are important things to mention.
Because that could indicate a variety of things.
It could be.
Blood pressure that's too high, or the medication of the high blood pressure might be getting to you.
Or a sudden drop in blood pressure is what we call postural hypotension.
So you would say that your doctor has to know.
Absolutely.
To get the best situation set up as far as therapy goes. That doesn't seem fair not to tell the doctor, let alone not tell the therapist. He's there to help you.
Absolutely, and if we don't get a referral, we can't help that patient. So talk to your medical professional, and it doesn't have to be the physician. You can also talk to your physical therapist. Might you be in physical therapy for another condition?
Right.
And we can then do an evaluation and maybe call the doctor and ask for a prescription and get therapy started that way.
So JB, you could, if you spotted a problem with a patient that was here with, say, some other situation that they're in for therapy, you could just tell them about it and say, you know what, as long as you're here, why don't we take care of that?
Absolutely. Absolutely. Incorporate it into your treatment program.
Does that happen often?
It happens quite a bit, yes. A lot of times a patient is referred for a status post-total knee replacement, and they go through 3 or 4 months of rehab. They do great, and they don't feel safe in the home environment. And at that point, we could do an assessment and take a look at their balance.
That's a great idea.
And in in a lot of cases, the balance component is already part of the physical therapy.
Yeah. Well, and I also think part of the senior situation is a little bit of our, well, we don't want people to know that we don't have good balance.
Mm-hmm.
Like they're not going to guess if you're teetering, you know.
Right.
And when the doctors tell them to use an assist, to use a cane, whatever, use it.
Absolutely. A lot of times these patients are getting around just fine.
Mm-hmm.
It's just not always safe.
Yeah.
And that's why a thorough physical therapy evaluation to look at the way they're ambulating, to look at their balance, to assess their strength can be very advantageous.
So like say they want to stay in their home, they have a couple steps they have to come up, go down, this type of thing, knee replacement, an injury, a sprain to the knee, a sprain to the ankle. It can make all the difference in the world for them to heal properly, to have, I mean, oh, I can exercise myself. No, you can't.
No. Every patient who comes to physical therapy will get a customized program by a highly trained physical therapist. Most physical therapists today graduate with a doctorate's degree, and they do a thorough assessment and then give you a very specialized, a highly specialized exercise program. It's hard to do yourself.
It seems to me like you're really into helping seniors.
Absolutely.
And I think that takes a special kind of therapist. Patience is a virtue, because a lot of times we don't want to talk about, maybe if we don't talk about it, it won't be so. I think
it's
you
true.
know, it's kind of Goldilocks and the Three Bears type of thing. But to be serious about it and want to stay in your home and have your home as safe as it can be, don't wait till your first fall. Get some of this information. I'm sure Mendelssohn's can provide you with that. Booklets, brochures, tell you how to fix up your house so you can stay there and put the information in your head.
Right.
I would like to thank you, JB, for being with us, and I would like to thank you for being here for the seniors here in Livonia.
No problem. It's been a pleasure.
I'm sure they will appreciate your work. Hopefully through a brochure.
Yes.
Thanks again. And we'll be right back after this message.
George, it's a great deal. Only used a couple of times, and it gets great parsecs for very little dilithium crystals.
Well, I appreciate the offer, but what I really need is information about Social Security. How do I find out what my monthly payment will be?
Online.
How about if I just want Medicare?
Online?
Oh my. We'll boldly go to socialsecurity.gov.
Let's go kick the tires.
Welcome back to the Primetimers. I'm Marty Moore, and we're at Mendelssohn Kornblum Orthopedics here in the city of Livonia and at St. Mary's Hospital. Joining us is Katie Pring. Katie is a physical therapist who's had a lot of experience. I'm so glad you could be with us. There's so much seniors need to know about keeping themselves safe, keeping themselves healthy, paying attention to themselves, making themselves number one. One of the things that usually gets skipped is the diet. How important is that to help a person not be falling on their face all the time?
Well, diet is important because you want to maintain a good blood sugar level. Whenever you had highs or dips in it, you run a risk of becoming fatigued or dizzy or unconscious, which increases your risk of a fall. So making sure you get your meals and snacks is very important for the elderly. And sometimes I feel that sometimes they don't take the time to make sure they have those meals.
Yeah, well, I don't want to do this right now, so I'll just have a cup of coffee, which is not going to help with the shakes or with the balance.
Right. More importantly, too, a lot of medications require the meals or a small snack.
That's true. So they are putting themselves in jeopardy for a fall.
Yes.
If they don't have a nice just that easy schedule to follow. It's not always easy to do, though. We're talking about falling and the prevention of falling. Where do you find that falls occur the most?
Majority of falls will occur in the home environment.
Okay.
With that being said, a lot of them will happen in the bathroom. The majority of them will occur in the bathroom.
Oh, and nothing but tile and stone and steel.
Yes,
Oh.
and the bathrooms is the place where the falls will occur because if you think about it, we're getting into and out of a tub. We're slippery or wet, which is with that tile increases our risk of falling.
Right.
Getting up from low surfaces.
Uh-huh.
A lot of times patients or the elderly will pull on a towel rack, and they'll lose their balance, and they actually pull that towel rack out of the wall.
Oh my gosh.
And then further fall and cause injury.
I know there's ways to get around that. You're going to have safe ways to use the bathtub.
Yes.
And safety things around you. What do you recommend?
Well, there's a lot of different safety features you can add to the bathroom. Handrails. You know, a lot of times people don't want to install them to the tub or in the bathroom because of the appearance, but Lowe's and Home Depot have come out with some really unique handrails that to the average person they wouldn't even tell that they're handrails, but they're sturdier. They can actually withstand and take the weight of a person if they needed it to brace themselves or to catch them from falling.
I mean, we're talking a guy 6 foot tall. He's going to weigh at least 180 pounds.
Yes, and Home Depot and Lowe's have a lot of those products there, and they're affordable.
What are some of the other ways that we set ourselves up for accidents and that we should be safety proofing? I was going to say child proofing, which is almost as good as senior proofing.
Right, right. Throw rugs is probably another huge thing where...
Yeah, but we've got to have those.
You know, yes and no. You can modify them.
Okay.
If you put double-sided tape around the edge so that you can't lift up if you catch your foot on them.
Yeah.
If you have an oriental rug that you really like, hanging it on the wall, doing something unique so it's not a tripping hazard.
Yeah, that's a really good idea. I know there's probably a dozen ways that just the junk on the stairway.
Yes, clutter, you need to have safe pathways to walk, so removing
we
anything.
can't throw anything away, you know. So we're just going to put it on the stairway and forget it's there, and down you go.
Right.
Then it's too late.
Right. A lot of things that I would recommend to some of the patients I would treat in the past is having an area where they store some of their items that they really like, but away from the hallways or away from the main paths that you're going to take to the pathway throughout the kitchen or from your bedroom to the bathroom, keeping those areas safe.
Because in your mind's eye, that's all clear.
Right.
If somebody goofs up and puts something in your way, or if you forget to move something. Yeah. So then comes the fall. There are other things that happen when you're not as nimble foot as you used to be. Granted, therapy is going to help us strengthen, but we still have to be aware of, just say for instance, what if you have a pet?
Good question. A lot of people will fall because of their pet. They'll get tangled in, the pet will go between their legs, and the next thing you know, the person is on the ground.
I've seen it a half a dozen times,
Yes.
This great big dog and this little person, and their kids think, oh, she's got to have a companion. So here we come with this big, Rin Tin Tin dog.
Right.
It's not
exactly,
gonna work.
and the companionship we do want. But we
Sure.
want to train the dog.
Yeah.
And there's different ways you can train the dog. Train the dog to go up the steps after you've reached the top of the stairs, or
Good idea.
to go first. Have the dog go, or the cat go first. It's
Yeah.
easier to train a dog, but to take those special steps. Have an area section off that the dog can't get into. So if the stairs is one of them, having that sectioned off with gates.
Yeah. Well, this is to protect yourself. some dogs are so big they go barreling through the house, they're going to knock you right over.
Right.
They don't mean to.
No.
But they're going to the front door because somebody's knocking at the front door, woof, woof, you know.
And that's something interesting as well. You want to train your pet to not respond to the doorbell or the telephone. The same thing, a lot of times a dog will become excited when they hear the phone ring, and the next thing it happens, the person falls.
I sometimes think if you're going to have a pet as a senior, that you as a senior and your pet should go to school.
Yes.
So they know what to, I mean, they have help dogs that they train. I think they should be able to train a companion dog.
Yes.
And they, of course, then could tell you what size you can handle and what size you can't. You know, I hate to say it, but, you know, what do you do if you fall? And it's not a matter, is it going to happen? What, 1 out of 3 seniors, 65 and older. So it is going to happen. What do you do?
Relax, be calm. The first thing is to be calm. If you've fallen and you're able to get up, you most definitely need to report that to your healthcare provider.
Yeah.
But if you're injured, the most important thing is getting help. Yeah. And if you're unable to safely get to a phone, you know, or to get into a standing position, scoot yourself around the house to get onto something sturdy, such as a sturdy chair, a bed. I caution people from pulling up on nightstands or dressers, because those dressers can fall on you. TV stands, you know, can fall on you. Yeah. So making first that you're safe, and if you can get to a phone or something sturdy, I recommend that people put the wireless phones around their house so that they're spread throughout the house. If you have a walker, invest in a walker bag, and put the phone with you in your walker bag so that
it'll always be
exactly
within arm's reach.
And another good resource is the Lifeline. And they have so many different lifelines now where they can be displayed as a watch or a pretty necklace that no one's really sure that it's a lifeline, and only you need to know, and just with a touch of that, if you were to fall,
you've got help.
Yes.
That would be important, especially if you're alone. We're here with Katie Pring, and we're going to talk a little bit more about fall prevention, keeping you safe, and a few other good things. We'll be right back.
Patty, I boldly went to socialsecurity.gov, and it's out of this world.
Socialsecurity.gov is a website for everybody.
Even teenagers?
Absolutely. Young people can help their grandparents with retiring online or getting extra help with their Medicare prescription drug costs.
So really, everyone of all ages should go to socialsecurity.gov.
Boldly go.
Welcome back to the Primetimers. We're talking with Katie Pring, who's a physical therapist, here with Mendelsohn Kornblum Orthopedics. And we were talking about if you happen to fall, Katie, what should you do?
First thing is always to remain relaxed and calm. If you're not injured at the time, do bring it up to your doctor and let them know that you have fallen.
Yes.
If you're injured, get help. You call, whether it's scooting yourself to a phone or having your cell phone with you, to call 911, so you can get the help that you need at that time.
Well, it seems like all those things happen so fast, and it would be hard not to panic. But maybe, as we mentioned earlier, if you thought about these things ahead of time, if you have a plan of action, this is going to help. And you have to tell your doctor about it.
Yes.
You cannot tell him, although I can see where that could happen pretty easy. When a person is, I don't think it's fair to the doctor for him not to know that you have fallen down because you're afraid always going to tell your daughter or tell your daughter-in-law type of thing. But these are things we experience as we get older. what are some of the steps that maybe we should be doing right now so we can prevent this?
Yeah, prevention is the key, as
Yeah.
you're stating. And first, making sure that your home environment is safe, removing the throw rugs, removing the clutter.
Yeah.
Another-
That's hard for me. Clutter is
It's hard for most people.
Yeah.
But making it safe. Also, enroll in an exercise program. A lot of community centers have senior centers where it keeps you active, keep your muscles strong, keeps your posture. A lot of these exercise programs, they work on your balance, your strength, your extensibility, your all those good stuff. Enroll in a Tai Chi program. Tai Chi has worked wonders with the elderly in balance, and yoga as well. Keep yourself active and review your medications with your physicians.
Good point.
You know,
Because that could be causing you trouble right there.
Right, and have those courageous conversations with your physicians, and even ask for that PT script. If you're noticing that you're starting to fall or feel weak, or you're noticing that maybe you're not walking as fast as you would like to, and sometimes you're tripping over things, ask your doctor if you can have that physical therapy script so you can attend therapy and have a lot of these.
Yeah, so all you really need
issues.
is then your prescription.
Yes.
I mean, because they're all for seniors exercising.
Yes.
Or, my goodness, you just go down to the mall. As one of the Primetimers suggested, do your walking at the mall. It's safe and it's warm and it's dry.
Exactly.
Thanks for that, Tom. It might be a very simple thing, but yet I guess maybe it's our pride. Oh gosh, I don't have as good a balance. Without thinking, we're putting ourselves behind the eight ball when we should be a little bit of practice here. It's just like anything else.
Right.
You have to practice this, practice that. At least try it. You might like it. You can talk about the physical therapy, the evaluation that a patient goes through. Maybe they don't want to hear the bad news, or like you said, maybe it's a little bit of ego too. But what can we do to encourage, like our parents, what would my kids have to do to encourage me to?
Prevention. Therapy does not have to be a result of a fall.
Yes.
And if we
Good
get
point.
that therapy started before a fall, we're ahead of the game.
Yeah.
The last thing from my experience is telling someone that they can no longer reside at home because they're unsafe to be their home environment. So don't be afraid to go to your physical therapist. We're here to help you. We're here to identify areas where we can strengthen, where we can work on balance before the fall has happened. Once the fall has occurred, it's too late. Now, there's this fear of falling. And there's that trust. And now physical therapy is more of a chore right now than something where we could have been used in the beginning as a preventative tool.
Yeah.
Prevention is the key.
I think you're right, Katie. We don't like to dwell on, well, I got to do this or that. Just make it like it's part of your life learning program. You are taking lessons in strength.
Right.
You're taking lessons in balance. If you look at it as a learning experience, I think you would be more, ready to go with the program.
And taking charge of your health.
Good.
And that's the key. Once a fall occurs and you're having to do the therapy, it's no longer fun. And now we're dealing with a whole different issues. We're dealing with pain and limitations in your walking. Maybe now you have to use a walker.
Oh gosh, that will end up, even though you don't want it around, that will end up being your very best friend.
Right.
Is that walker. People, and when you're going through all these things, you really.
Right. So if you look at the long-term effects of not having your balance or your addressed in the beginning, you're looking at a road where you're gonna not be happy, and it's better to get it addressed in the beginning.
Yeah, that's a very good thought, Katie. we can't plan ahead for a lot of things, but maybe if we strengthen our bodies a little bit, we could plan to be stronger for whatever it is that's going to be coming our way.
Exactly. And rest assured, if a fall were to occur and there is an injury, physical therapy can still work on those same attributes, so the strength, the balance, to prevent future falls as well.
Well, I know my husband took advantage of the therapy, and he's had the rotacuff, a couple of knees. You have to have the therapy, and Mendelssohn's, of course, was wonderful as far as getting him back on the road, and also the people aren't aware. The guys that come to your home, the therapists come right to your room to make sure that you are getting started on the right plane. Then, when they're through, then they want you to come back here to Mendelssohn's and get a little stronger. And what people don't realize is they could be doing this all the time.
Exactly.
It's a fun thing.
Exactly.
But see, we wait until there's an emergency. That's where it happens. Right. So if you were advising a patient had just come in, what would you say to this patient about prevention? I want you to ABC, and be careful about ABC. What would you tell them?
The best thing I would tell them is you need to take charge of your health. And
okay, we're going to take charge of our health.
And we're going to enroll in a routine exercise program.
Okay.
Where we're addressing the balance and the strength. And we're also going to make sure our home environment is safe.
Okay. That sounds like a very good prescription. And even though we have some hard-headed seniors, I think they're not just hard of hearing, they are hard-headed. So, but getting the message through to them, you wouldn't let your kid run in the street,
right.
But yet you don't take care of yourself.
And it's about giving people choices.
Right.
We all have choices, and we want to provide them with the best choice. And by giving them that opportunity to choose the path, I find that people are more willing versus if I was to say, well, you're going to do this, this, and this.
Yeah.
It's, well, we can recommend these programs, we can recommend these exercises, and the reasons why is because we care about you. Right. We don't want you to have that fall.
Exactly.
People are more willing to listen and more willing to attend our program versus if I just presented it as like, do this or not. It's like your kids. They're going to do the opposite of what you tell them to do.
Exactly. Exactly. We're known for that. Well, listen, if you had a quick bit of advice for our viewing audience, 65 and older, 1-to-1 to senior, what would you recommend?
Pay attention to the early signs.
Okay.
If you're noticing you're stumbling or you just don't feel like you have the strength or you're tripping, it's not normal to fall as we get older. Big misconception. Yeah, we may be more inclined to fall, but it's not normal. So if you start to notice the early signs, have that conversations with your physician and ask for a prescription for physical therapy where we can address it before the fall occurs.
Katie, wonderful, wonderful. Katie Pring, I'm going to come and see you before I have my accident. And Katie, I want to thank you. You've been a wonderful guest, very informative. Katie Pring, who is the physical therapist here at Mendelssohn Kornblum Orthopedics. And I'm Marty Moore, and we'll see you next time on the Primetimers on Livonia Television.